My name's Kay Thompson. I work at Townsville Aboriginal and Islander Health Service over at the Mums and Babies Clinic as a health worker / research assistant.
But yeah, I haven't smoked since.
We have a smoking cessation project going at the moment. It is to help Aboriginal and Torres Strait Islander women, pregnant women, quit smoking during their pregnancy. The smoking cessation project, I think, is important because the rates of smoking in pregnancy in Indigenous women is 65% opposed to 20% in non-Indigenous. And while you smoke, it may lead to spontaneous abortion, miscarriage, double the risk of low birth weights and SIDS. Leah's been coming to Mums and Babies Clinic since her first pregnancy.
Hi Leah, how are you?
She came in as a smoker and gave up within the first 2 weeks. But then she took up smoking again 6 months post.
So how you been?
I've been alright.
35 weeks. Any cramping?
No.
Leah's now coming back to the program with her second pregnancy for her 34 to 36 week survey and antenatal care.
Just take a seat down a little bit.
Leah's now quit smoking.
How are you going today? Good? You feeling well?
Yep.
I know that you cut out smoking, which is great, really well done. Is that still going well?
Yeah.
Yeah, not smoking?
No.
Yeah, what about your partner and that? He
No, he doesn't smoke at all.
Oh, fantastic.
So, yeah, that's a big plus for me.
Oh, that's great. And great for the baby, isn't it? Yeah.
Most of the girls are aware what smoking is doing to them, but I don't think they realise what it's doing to their unborn baby. So once we talk to them and make them aware of that, then they sort of feel, oh, I didn't realise that cigarette I'm having is affecting my baby as well.
There we go, Bob's heart rate. Sounds good, doesn't it? Nice and healthy. Yeah.
They come to the clinic, they'll see our midwife and the doctor will just do a little bit of intervention with them to see how they're going.
As you know, that with the smoking there are lots of hazards for the kids and mother both, and even if there is passive smoking, that the partner is smoking around you, you can get a lot of fumes into your system and it can affect your baby. So that's very nice to hear that you don't smoke. Okay.
Then I will see them. I'm just constantly talking to the girls. Every time they visit the clinic, I'll approach them. Just a few questions about when you were smoking. How many times did you try before you finally gave up?
Probably about 1 or 2 times.
A lot of our girls have big families and they have a lot of people living in the same household because you have aunties and extras, so it's a lot of strain on our mums. Plus a lot have a few children, and the way they feel they can cope with the stress is have a cigarette. We advise the girls to go cold turkey because, you know, cutting back's great, but cold turkey, the more you do it, even if they're smoke free for 1 day, that's less chemicals that are going through their system, opposed to cutting back to a half a cigarette or something. They're still getting that exposure to the nicotine. So we have our posters out there. When the girls are recruited, we have a lot of brochures and we'll give them stress beads. So they feel the urge to have a cigarette, well, you play with your little beads. And we also have available nicotine replacement therapy. Plus, we provide transport for our clients, and that is major. We've got our clients out there that don't have transport, so then they can't get from where they live over to the clinic. And all through the smoking cessation program, we provide little incentives for our girls to keep going. They're helping us with our project, so we want to offer them something in return. And we're the only trial site that offers incentives.
Thank you.
And thank you very much for being part of our study.
Thank you.
The smoking cessation program is a 5-year program. It finishes in 2009. But I feel that every day there seems to be a lot more non-smokers coming through our clinic, and that maybe they're aware that this is a good thing.